Why do some people sleep with their eyes open? Sleeping with eyes partially or fully open is a condition known as nocturnal lagophthalmos. It occurs when the eyelids do not close completely during sleep. Several factors can contribute to this condition. 1. Facial nerve issues, damage or weakness in the facial nerves, which control the muscles responsible for closing the eyelids, can prevent them from closing fully. 2. Thyroid eye disease. This condition can cause the eyes to bulge, making it difficult for the eyelids to close completely. 3. Injury or surgery. Trauma or surgery to the eyes or surrounding areas can affect the ability to close the eyelids. 4. Sleep disorders. Certain sleep disorders or issues with REM, rapid eye movement, sleep can sometimes cause the eyes to remain open. 5. Genetics. Some individuals may simply have a genetic predisposition to sleeping with their eyes open. What about people who sleep with their mouth open? Sleeping with the mouth open is a common occurrence and can be attributed to various factors. 1. Nasal congestion. When the nasal passages are blocked due to allergies, colds, or sinus infections, people may breathe through their mouths to get enough air. 2. Sleep apnea. This sleep disorder, characterized by pauses in breathing during sleep, often causes individuals to sleep with their mouths open to maintain airflow. 3. Anatomical factors. Certain physical characteristics, such as a deviated septum, enlarged tonsils, or a small jaw, can make nasal breathing difficult, leading to mouth breathing. 4. Habit. Some people may develop the habit of sleeping with their mouths open due to prolonged nasal congestion or other factors, even after the initial cause is resolved. 5. Muscle relaxation. During deep sleep, the muscles around the mouth and throat relax, which can cause the mouth to fall open, especially if lying on the back. Potential effects and solutions for sleeping with eyes open. Dry eyes. This can lead to discomfort, irritation, and potential damage to the cornea. Treatment. Using eye drops or ointments before bed, wearing moisture goggles, or taping the eyes shut with medical tape can help. Consulting an eye specialist is recommended for persistent issues and for sleeping with mouth open. Dry mouth. This can cause bad breath, tooth decay, and gum disease. Snoring. It can contribute to snoring and disturbed sleep for both the individual and their partner. Treatments includes addressing underlying nasal congestion, using nasal strips or decongestants, practicing good sleep hygiene, and seeing a healthcare provider for sleep apnea or other concerns can be beneficial. Understanding these behaviors and addressing any underlying conditions can help improve sleep quality and overall health. Don't forget to subscribe, like, and share for more fascinating facts and content for everyone. Stay tuned for more amazing discoveries.